All right. I am going to go ahead and start it and get things rolling. Good afternoon, everyone, and thank you for joining the Virginia Governor's Conference on Aging webinar series. We're going to give everyone just a second to get in and get situated, and then we'll get started. All right. Thank you, everyone, again for joining us today for the Virginia Governor's Conference on Aging webinar series sponsored by Virginia Housing. Thank you to Virginia Housing for making this webinar series possible and supporting not only the webinar series, which is ongoing and came out of COVID, but also being so supportive of the conference, be it in person or our virtual conference that happened this past year. We are really fortunate to have a great number of webinars that we've brought to life over the past 18 months, and we're really looking forward to hosting this series going forward into 2022. And we hope you will join us next month. Again, this month is a week early due to Thanksgiving, and next month is a week early due to the holidays. Next month, we hope you'll join us on the 14th. From 1 to 2 o'clock for Toxic Ageism, Losing a Decade of Longevity, presented by Dr. Jay White, who is a gerontologist and certified dementia practitioner. You can register for that webinar at vgcoa.com. You can also find more information not only about upcoming webinars, you can also find the link to our YouTube page where all of our webinar recordings are posted, as well as all the information about upcoming events and related information about the Governor's Conference on Aging. Before we get started, and I hand it off to our presenter this month, George Worthington, I wanted to cover a couple housekeeping items. We encourage you to submit your questions throughout the presentation in the Q&A box. We'll take questions at the end of the presentation. You can also use the raise the hand function at the bottom of your screen, and we can allow you to unmute and ask your questions live to George at the end of the presentation and interact in real time. And we encourage you to do either one of those as you feel comfortable. We'll take those questions at the end. And also just share any thoughts and comments throughout the presentation in the chat function and interact with other attendees as you feel comfortable. Again, we thank everybody for being here. This is being recorded, and we'll share all the information after the session is over about the recording, where you can find it, how to contact George Worthington for any follow-up information and questions, and other upcoming webinars later this afternoon. So with that, George, I'm going to hand it over to you and let you take the presentation.
Thank you so much, Martina. Okay, let me pull up my screen. Okay, I think you can see that now.
Yep, looks great.
Great.
Oh, well, you're went away.
All right, let me try that again. All right, looks like it's up now.
Looks great.
Great. So thanks, Martina, and thank you everybody for joining today. It's my absolute pleasure to be here, and I'm really excited to share information with you about Virginia's dementia infrastructure and some new initiatives that we have coming up, and also existing programs and supports and services. But I wanted to start by asking you a question. So how many people do you think are currently living with dementia in Virginia? So if you could just pop your answer in the chat to how many people you think are living with dementia in Virginia, that would be great. And I'm just gonna, while you're doing that, I'm gonna give you the outline of today. I'm gonna it's pretty much as the title says. I'm going to talk about Virginia's dementia infrastructure. So what sorts of structure there is around supporting dementia services and supports. And then I'm going to talk about, as I said, current and new initiatives. So I'm just looking at some of the numbers in the chat. We've got a really wide range. So 10,000, 50,000, 2,500, 50,000, 75,000, 250,000, 10,000, no idea, 1 million. Okay, so there are about 8.5 million people in Virginia. And the true answer is we don't know exactly how many people are living with dementia in Virginia. So I'm going to give you 3 different numbers that will provide us with, I guess, a range. So the top table, the top numbers in the table here are, this you can consider as a kind of minimum number. So there are at least this number of people living with dementia in Virginia. This counts actual numbers of Medicare recipients with a diagnosis of Alzheimer's disease or related dementia marked in their health records, and who received a service through Medicare in year 2018. So that was 108,864. So there are at least that many. That excludes Medicare beneficiaries who are on Advantage plans, and that's about 1/3 of Medicare recipients in Virginia. So you've got to figure there's quite a few more. The Alzheimer's Association provides estimates every year. For 2020, they estimate 150,000 Virginians living with Alzheimer's disease. So there, you have to add in people living with other forms of dementia to that. And if you figure Alzheimer's disease is 60 to 80% of all dementias, then you're looking at a number closer to 200,000. But at any rate, the Alzheimer's Association is looking for a really big increase by 2025. And then another number that we have, which I kind of think as an upper bound of the number of people living with dementia, is the number of Virginians experiencing what we call subjective cognitive decline. You may not have heard of this. This is somebody's self-reported memory loss or changes in thinking that are getting worse over time, that they feel are getting worse over time. And the last time we asked this question was in 2019 through the Virginia Department of Health Behavioral Risk Factor Surveillance Survey, System Survey. And extrapolating out from the numbers, there were about nearly 300,000 people experiencing some form of memory loss. So that's a huge number. But as you can see, it's a wide range. This map, before I get into the meat of the presentation, just shows you using the numbers from that top section of the table, the CMS numbers, the Centers for Medicaid and Medicare. You can see where the highest percentage of folks with a diagnosis of Alzheimer's disease are by county. So a lot of the urban areas have a relatively high prevalence, and also some quite rural areas. So not quite sure why the distribution is relatively uneven, but it might be that people in urban areas have more access to diagnostic facilities, and there might be a higher prevalence of dementia in more rural areas as a result of higher levels of chronic conditions that may increase your risk of developing dementia. So that hopefully provides you a bit of background and some idea of the size of the issue in Virginia. So now I'm going to move right into our dementia infrastructure. So here in Virginia, of course, the General Assembly and the governor have ultimate responsibility, but most dementia policy or services comes through the Health and Human Resources Secretariat, and particularly these 4 agencies. So the Department for Aging and Rehabilitative Services, where I work, has primary responsibility for dementia services. Under the department or within the department or attached to the department is the Alzheimer's Disease and Related Disorders Commission, the ADRD Commission. you see there. And that, I'm going to talk more about that in a minute. But below the DARS, you see the area agencies on aging and the Centers for Independent Living. So those are our networks of local agencies that provide many of our services. Department for Medical Assistance Services, or DMAS, provides Medicaid, obviously supporting lots of folks living with dementia. Department for Behavioral Health and Developmental Services, DBHDS. While they don't have responsibility for people living with dementia, as it's not really considered a mental illness, they do support many folks living with dementia who may have another diagnosis as well through the state hospitals and laterally by the community services boards. And then finally, the Virginia Department of Health, and that's through mainly public health, but also through gathering data through things like the behavioral risk factor surveillance system. So I'm not going to talk about all of those in much detail, but I will talk about a few of them. So the Alzheimer's Disease and Related Disorders Commission, that is, as I said, attached to DARS. It was set up in 1982, so it's going to be 40 next year. It's responsible for advising the governor and the General Assembly on all things dementia, so policy, funding, regulatory issues, anything like that related to dementia. They're also responsible for developing and helping implement and advocate for the Dementia State Plan. Virginia crafted its first Dementia State Plan in 2011, and we aim to update that every 4 years. So the most recent one was published at the end of 2019 to cover the period 2020 through 2024. In that plan, there were no changes to the main goals, which I'll cover in a minute, but we did include some new things like dementia-friendly initiatives. And the whole state plan is really a blueprint for a dementia-capable state. One of the key recommendations in the first state plan was my role to create a Dementia Services Coordinator. So that was funded in 2012 or 2013. The Alzheimer's Disease and Related Disorders Commission has a website called allspossible.org, and we also have our internal page, vda.virginia.gov/dementia.htm, which on both of those pages, you can find lots of information about dementia. On allspossible.org, we have a library of about 70 webinars related to dementia and caregiving and all sorts of things. On the vda.virginia.gov dementia page, we have information on the state plan, data, and also the programs and services that we support, as well as links to a host of other resources. And finally, we have a network of memory assessment centers. Not quite found. One more after this. So we have the network of memory assessment centers, and I'll show you where those are in a couple of minutes. But those are dedicated memory clinics where people can get a full diagnostic workup, which is particularly helpful in cases that aren't clear, and also follow-up care. Then we have the No Wrong Door Network, which includes the area agencies on aging. So the No Wrong Door Network, many of you are probably familiar with. It helps link Virginians to a range of about 26,000 supports and services. So of course, not all of those are dementia specific, but many are. And so folks who are looking for services and supports can access those through No Wrong Door. So just a little bit more detail about the Alzheimer's Commission. As you can, I won't go through all of this, but we do have a wide range of membership. The Commission supplies an annual report to the Governor and General Assembly every year. So you can look at that. That contains our legislative agenda or specific issues that the Commission is advocating for in any particular year. And the Commission also has work groups that are tied to specific goals of the Dementia State Plan. And so many of the initiatives that I'm going to be talking about today are coming out of those work groups. So these are the roles and responsibilities of the commission. It's, as I said, is really responsible for all things dementia in the Commonwealth, including advising the Governor and General Assembly, but also developing and promoting strategies to encourage brain health and reduce cognitive decline. So we're trying to reduce the prevalence of dementia going forward. And as I mentioned, developing and advocating for the state plan. These are the 5 goals of the Dementia State Plan. They have been part of the plan ever since its inception. So goal 1, coordinating quality dementia services in the Commonwealth to ensure dementia capability. That's really where DARS is standing out. It helps coordinate things, services and support through different agencies, and also ensure that information is being disseminated appropriately. Goal 2 is to use dementia-related data to improve public health outcomes, and that also includes improving our data collection. So as you saw from the very first slide, we're not really sure about the number of people living with dementia, the number of caregivers. We don't even have a very clear picture of exactly where they are. So improving data, trying to use all sources that might help inform our understanding of dementia. So for example, one thing that we look at is wandering reports from the state police. So that can help direct training programs. And I'm going to talk a little bit more about the public health outcomes because we have a grant program underway that is specifically aimed at that. Goal 3 is to increase awareness and create dementia-specific training. So I'm going to talk about a few of those training programs, but this is about training not only for professionals working with people living with dementia, but also for family caregivers. And increasing awareness through things like providing Dementia Friends education and other educational opportunities. The goal there is really to help raise awareness and reduce the stigma that surrounds dementia. Goal 4 is to provide access to quality coordinated care for individuals living with dementia in the most integrated setting. Coordinated care or care coordination or dementia care management, it goes by many names, is really important for providing or helping achieve the best outcomes for people living with dementia. So coordinating those various services that people need at different stages of the disease process is really important. And one of our key goals is to try and improve access to that coordinated care. And I'll talk a bit more about where we are in that in a few minutes. And then goal 5 is to expand resources for dementia-specific translational research and evidence-based practices. So it's a bit of a mouthful, but essentially it's about taking what we're learning from research, not only in Virginia, but elsewhere, and translating that into specific programs and supports and services that can really help people living with dementia and their caregivers achieve better outcomes. Within aging services, so I like to think about our dementia-capable system. We have the area agencies on aging. So many of them have had their entire staffs educated on dementia. We also provide training for specific roles within those area agencies on dementia capability. Home and community-based services, these are essential to providing care at home for people. And many of these, again, have had specific dementia training, and we're trying to encourage more and more of those services and programs to take specific dementia training so that they're better able to serve that growing population of people living with dementia. And then finally, long-term care services. So while most people with dementia are being cared for at home and so therefore rely on the services provided by the area agencies on aging and home and community-based services more generally, long-term care services are essential. So for many folks, it becomes impossible to provide appropriate and safe care at home for people living with dementia, particularly in the later stages of the disease process. So long-term care services would be nursing facilities and assisted living facilities that can provide that specialized care. So I'm going to talk about a few specific programs that are operating in Virginia. So back to dementia care coordination, we're super excited that the General Assembly funded dementia care coordination for the first time. Prior to that, we had piloted an initial program starting in 2016 using federal grant funds, but the General Assembly provided funding starting this year through DARS to the University of Virginia's Memory Disorders Clinic in partnership with the Alzheimer's Association. So that $150,000 will provide the capacity or provide care coordination for 50 families. So it's one full-time dementia care manager using the evidence-based Benjamin Rose Institute Care Consultation Program, which many of you may be familiar with. It's primarily a telephone intervention, but here in Virginia, we've added in home visits to better understand the people and the families that we're working with. And it's been very successful in terms of beneficial outcomes such as reducing depression amongst both people living with dementia and caregivers, increasing caregiver self-efficacy, which basically means people feel more able to provide the care that their loved one needs, and a number of other really beneficial outcomes. The other program that we have is run by my colleague here at DARS, Liza White, the Virginia Lifespan Respite Voucher Program. We're again very excited to have received a recent federal grant to fund this program for a further 5 years. That provides up to $595 in reimbursement for respite care. And while this program isn't specifically or isn't restricted to people living with dementia or caregivers of people living with dementia, many of the folks that are using this program or have enrolled in it are caring for somebody living with dementia. So it allows families to, say, a family caregiver who really needs a break to hire somebody to come in for a weekend or a few hours, and the state will reimburse them for up to $595. I mentioned grant-supported services already. So these are a few programs that are recently finished or underway. So the first one here, the CDC Centers for Disease Control BOLD Act grant for public health programs. The BOLD Act is the Building Our Largest Dementia Infrastructure Act. This was passed by Congress in 2018, came into force in 2019. The CDC started its round of grant offerings in 2020. And Virginia was one of the first states awarded one. And because of our existing infrastructure, such as the Alzheimer's Disease and Related Disorders Commission and the Dementia State Plan, we were able to get an enhanced grant. We were one of, I think, five or six states to get that. And the states that the other states awarded those are often the ones that are thought of as on the forefront of providing better dementia services and supports, like Wisconsin and Minnesota. So that was very exciting for us. That was awarded to VDH. DARS and the Alzheimer's Association are key partners on that grant. And this is really about improving brain health education around the Commonwealth, really incorporating information about dementia and specifically dementia risk reduction into brain health messaging more broadly. So that can be things like when there is messaging or public health programs around cardiac health, so heart health, that link to brain health is included. So for example, having I guess the short version would be what's good for your heart is good for your brain. So that's the sort of message that we want to get out. And then more specifically, things like controlling hypertension, high blood pressure, or high cholesterol, which also are damaging to your heart, are also going to help reduce your risks for developing dementia going forward. We're also developing a brain health and risk reduction module for Dementia Friends in coordination with Living Age Virginia, who we partner with for the Dementia Friends Virginia program. So hopefully that will be ready in a few months, and we'll start rolling that out as an addition to the Dementia Friends information sessions. The next two grants, the ACL ADSSP and ADISSP, I'm not going to say what those stand for because I'll get them wrong, but basically they are Alzheimer's disease program grants. We've had two here in Virginia. The first supported a program called Families and helped helped improve dementia capability more broadly through developing training modules and things like that. The Families program is an adaptation of the evidence-based New York University caregiver intervention, specifically aimed at caregivers of people living with Alzheimer's disease. So we expanded that to include caregivers of people with all types of dementia, and expanded the definition of caregivers from just spouses to family caregivers more generally, and then caregivers broadly. And then through the second grant, the ADISSP, we were able to start that care coordination pilot at UVA's Memory Disorders Clinic back in 2016. And that program hired 2 dementia care managers who were able to provide care coordination for at least 100 families a year over that period. And they've since had subsequent grants that have helped sustain that program. And as I mentioned at the top, we've got state funding this year to help continue that. And then finally, the Virginia Center on Aging, Geriatric Training and Education grants have been really very helpful in helping us sustain the Families program. So we were able to provide training for additional counselors in 2018 and expand that program from originally just around Charlottesville and Williamsburg to many other areas of the Commonwealth. And then in 2019, actually 2020, we trained 19 facilitators to deliver the evidence-informed dealing with dementia caregiver workshops. So this is a really excellent program from the Rosalind Carter Institute. And unfortunately, COVID intervened just as we were rolling this program out. So it is in-person workshops, and so those have been delayed. But we were able to support those trainers and also purchase a large number of the Dealing with Dementia caregiver guides that participants receive in those workshops to enable nearly 800 people to complete that workshop free of charge. So we're very excited about that, and so thankful to the Virginia Center on Aging for those for that grant funding. So now I'm going to switch gears and move into our current programs and some new things that are coming up that we're very excited about. Dementia Capable Virginia. So this is going to be our new umbrella brand for our dementia products and resources that are coming out of DARS and the Alzheimer's Commission. So that will include some existing resources that we're going to rebrand as Dementia Capable Virginia, but we wanted to have an umbrella that people would be able to recognize, and it would include resources that are aimed at a wide range of a wide audience. So not just for individuals living with dementia and their caregivers, but also products and services and resources aimed at service providers, primary care providers, and also researchers. So Those are the maybe the legs of the table of what it means to be dementia capable. So we want to include all of those within this new brand. I was hoping to share our new logo with you today, but it's still under development, so I wasn't able to. But we're hoping that this will be approved by the next Alzheimer's Commission meeting in December, and then we'll be able to share that more widely. But I'm going to talk about a few of the materials that we have under this Dementia Capable Virginia umbrella. So we are developing a web page that will contain all these materials and links, and kind of integrate what we currently have spread out over 2 or 3 different websites into one. So this can be your one-stop shop for information about what services and supports are available, as well as specific resources and then links. So some of these I'll go through in a little more detail in a second. The dementia roadmap I'm going to talk about, and also the safety information toolkit and fact sheets. The primary care dementia toolkit I'll talk a bit more about as well. The training modules, so we have some training modules for primary care staff that were developed with one of those federal grants. They're currently available. We also have the person-centered dementia-capable training modules for area agency on aging staff that I mentioned earlier, also developed with a federal grant. Those, while they are aimed at specific roles for area agency on aging staff, we've had a lot of people who don't work for area agencies on aging, but are looking for some training around person-centered dementia care and interaction. And so it's exciting to see those other people making use of these. And then we're currently working on a micro-learning module for APS staff around dementia, which will be rolled out hopefully next year. We also have a listing of the memory assessment centers that serve Virginians, and then we'll have links to the dementia-friendly initiatives underway in Virginia. So this is one of the most exciting things I have to share with you today. This is our new Virginia Dementia Roadmap. We cannot take full credit for this. This is an adaptation of a product developed in Washington State, which I saw a few years ago and felt we need something like this in Virginia. It's such a fantastic resource for families. So what it does is it takes you step by step, stage by stage, through the disease, from wondering and worried through to mild cognitive impairment, early stage dementia, mid-stage dementia, and then finally late-stage dementia. And at each stage, it gives you what you should expect, things you may be wondering about, what you can do, and then very specific action steps that people can take at each stage. So I'm also going to highlight 2 things on these pages. One is the fantastic and beautiful and very moving caregiver portraits that Michael Geller was so kind to share with us. He created these as part of a series, and they were exhibited at the Chrysler Museum in Norfolk a few years ago. And he also allowed us to use some extracts from the interviews that he conducted with these folks. And I think they really speak to the breadth of experience around dementia and caregiving, but also really highlight that personal nature of dementia. So one of the things you may have heard is that when you've met one person with dementia, you've met one person with dementia. Everybody with dementia is unique. And I think these caregiver portraits and quotes really speak to that. And the other thing that I'm going to highlight here is the artwork down the sides that you can see in each page. These come from works of art created by people living with dementia through the Opening Minds Through Art program, run by Cindy Pollin and, her program escapes me right now. I'll think of it in a second. But That's a program based in Richmond. It's an evidence-based program, and it helps people with dementia express their creativity. And we were so excited to be able to use these really exciting pieces of art in our new product. It also has a new section that we took much of the information from Washington, made it relevant to Virginia, and then we included a few things that we thought would be helpful, such as information about younger onset Alzheimer's disease, and then some information directed at the caregiver, so caring for the care partner. So we want people to caregivers to remember to take care of themselves and to be able to forgive themselves when caregiving is difficult, and we want to provide some support and things to make that a little bit easier, but also to help people understand it's okay to ask for help, and it's okay to be less hard on oneself. And then we have, of course, a large number of resources aimed at connecting people with really good quality information about dementia and caregiving and specific issues like driving. That will be available early next year. We're going to have that in hard copy and PDF version. And we're planning on making that available through the network of area agencies on aging. The other new product, so this is also adapted from a Washington State product, the Dementia Safety Information Toolkit. So this covers specific issues around home safety, falls prevention, driving, wandering, emergency preparedness, elder abuse, and financial exploitation. So while these, again, are not necessarily dementia specific, they do have incredible resonance and are very important for folks who are caring for somebody living with dementia at home to be aware of. So this is really a document full of links to more detailed informational resources. So we tried not to be overwhelming, so there's about 3 or 4 links under each of those topics, but again, they're very high quality evidence-based products where we could find them. Next, we have the dementia fact sheets. So these, again, are something that we already have on our DARS website. These were adapted from products developed by Alzheimer's Greater Los Angeles. If you sense a pattern here, that there is a reason for that. So we don't believe in reinventing the wheel. It's when we find a really good resource that we think will be helpful and useful for people in Virginia, we ask for permission to adapt that. And often folks are really happy that you want to, and very encouraging and supportive in the process. So these dementia fact sheets we adapted a few years ago. They're in English and Spanish. You can download the PDFs on our website, and they cover the topics you see here. There are, so Alzheimer's Greater Los Angeles has developed some more that we're currently talking about adapting. Then the next thing we're offering is the Primary Care Dementia Toolkit. So this is really aimed at helping improve detection of dementia and memory change and follow-up care in the primary care setting. So this contains a number of screening instruments. So we have a 4-step process. Number 1 is cognitive screening. So we have links and or the actual screening tools included in the toolkit. We have links to training videos that the primary care workers can view to get a better understanding of how best to use those screening tools. If indicated, then we would encourage folks to refer for diagnosis to either a specialized dementia care clinic or a neurologist who can do that specialized diagnostic evaluation. Number 3 is the follow-up care planning. So here again, we've included a number of products developed elsewhere that really provide good guides to care planning from a primary care perspective. And then we want to make sure that patients are connected to appropriate supports and services. So one of the things we sometimes hear is that my grandmother got a diagnosis of Alzheimer's disease, and the doctor said, "We'll see you in 6 months." But didn't provide a referral to the Alzheimer's Association or the Area Agency on Aging or anything else. And so we want to make sure that primary care facilities know about these resources and know to refer their patients to them. Medicare has a number of billing codes that primary care staff can use and to charge for some of these or to bill for some of these services. So we've included information about that as well. And we're going to be piloting this in several primary care settings over the next year. So again, very excited about this. And I'll just say, so this came out of the training work group of the Alzheimer's Disease and Related Disorders Commission. And those previous documents came out of the Coordinated Care work group of the commission. So they've been busy. We also have these training modules, this all falling under the umbrella of Dementia Capable Virginia. These person-centered dementia capable modules for options counselors, information referral specialists, and care transitions coaches. These are available now. We also have microlearning modules, again, developed with federal grant funding. These were developed for primary care providers with our partners at Riverside, Center for Excellence in Aging and Lifelong Health in Williamsburg. They're really short videos highlighting these 5 topics, and they're currently available on the allspossible.org website. And here is just a map of the memory assessment centers. So on the Dementia Capable Virginia website, you'll be able to get full information about these clinics, contact details, what services they provide, and things like that. But you can see that some of these clinics aren't actually located in Virginia, but they are near enough that they do serve Virginians. And we hope to see this number expand going forward. And then I'd like just to close out, talk about dementia-friendly initiatives. So many of you have probably heard about these. There are 2 main initiatives, Dementia Friends and Dementia Friendly Communities. So Dementia Friends Virginia, as I mentioned earlier, it's run in partnership between DARS and Leading Age Virginia. This is a program where we train people to go out and deliver 1-hour information sessions, the Dementia Friends information session. And the goal is really to help individuals learn more about dementia, feel more comfortable about interacting with people with dementia, and help reduce the crippling stigma that often surrounds dementia. So that's kind of, that is a grassroots effort. So as I said, we're working on adding in some information about brain health and risk reduction into that program, so it can be even more comprehensive. But it's a really good introduction to some of the issues around dementia, and in particular helps give people an understanding of what caregivers might be experiencing as they care for somebody living with dementia. And then the dementia-friendly communities initiatives. So these are just a few of the dementia-friendly community initiatives underway in Virginia. There are several more. I just didn't have room to fit them all on the page. But they're overseen, they're all part of the Dementia-Friendly American Network, which is run or supported by, used to be N4A and now has changed its name. But these communities, these are local organizations, often volunteer-led, and sometimes with some agency support, that are working to help raise awareness and improve the ability of people living with dementia and their caregivers to better engage with their communities on a much broader level. So they're working with different sectors of the community, like faith-based organizations, first responders, local governments, to try and help increase understanding of the issues surrounding dementia, what might make it easier, how to make things easier for people to better engage with their communities. And several of these are also working with their local age-friendly initiatives. So, for example, Dementia Friendly Central Virginia in Charlottesville is working with the Charlottesville Area Alliance that is supporting the AARP's Livable Communities Initiative. So lots of great work going on in this area, but we'd love to see more dementia-friendly community initiatives come up in Virginia. So if anybody listening is interested in helping develop one of these in their own community, please don't hesitate to get in touch with me, and I can help get that off the ground. That is all I wanted to share with you today. I'm just going to close on one final note. So the third work group from the Commission, the Data and Research Work Group, is currently putting together a survey on research issues. So this is not just aimed at researchers, but we want to know from people in the community, people who might be referring folks to research participation, people who might be thinking I might be interested in participating in some research, but aren't sure what to do or what that might look like. We want to know, we want to hear from all of you. So this survey is going to be launched towards the end of January, beginning of February. Martina has kindly said that we will be sharing this with everybody watching today. So I would encourage you to respond to that survey. It shouldn't take very long, but we really want to learn what can help increase research participation, particularly among underserved communities, to ensure that everybody is represented in research programs and that the outcomes from research can better help support all of our communities. But here are my contact details. Please don't hesitate to get in touch with me through email or phone. The website there again, that's our DARS Dementia Services webpage, and you'll find links to everything that I've mentioned there, apart from the things that we haven't released quite yet, but are up and coming. So thanks for your attention, and I guess let's turn to Q&A.
Yeah, we have several questions that have come in. If people have questions, they can submit them in the Q&A box, but we've had several come in already. Well, first, we'll send out this recording. A couple people have asked if this presentation will be available afterwards. It will be recorded. It is being recorded and is available after the presentation closes. So we'll send that out afterwards. One of the questions in relation to that is how can we access the toolkit? And if the answer to that is something you can share with me, George, I can also include that in the post-webinar email that I can share with our attendees, if that's an easy access piece that I can share with our attendees in that post-webinar email, or any other materials I can send out to our attendees.
Yeah, that's the safety information toolkit.
I believe so. It just says, how can we access the toolkit? That's from Galar Basari, and I apologize if I messed up your name. But if you might be able to clarify which toolkit, yes.
So the Dementia Safety Information Toolkit is available now on the webpage you see here, vda.virginia.gov/dementia, or if you search for DARS Dementia Services, that should pop up, and it's highlighted on the webpage.
All right, and we'll include that link in the follow-up email as well. One of our other questions is required training for staff in nursing care facilities regarding dementia is minimal. How might we advocate for improvements in this area?
That is a great question. So that will require some changes to regulations. So a good way to advocate for that is to speak with your local delegate or state senator. So as you know, we've got a new General Assembly coming in early 2022, this is a great opportunity to tell your local delegate or state senator what matters to you. And if that's something that matters to you and you have a personal experience around that, then that would be great to share. And that goes for any issue around dementia. But yes, that would require some regulatory changes.
All right. How does dementia, in quotation marks, dementia capable state help the caregivers? I don't really know what dementia capable state is. And there were a couple of questions about this also in the chat as well. Looking for a little bit of clarification, a little further clarification on that as well. Yeah, so dementia capable, I guess that's a term that we kind of throw around a little bit. Basically, it means that if a state or a community is dementia capable, it means that it has the services and supports that are needed to provide to support people living with dementia and their caregivers. So whether that's training programs, home and community-based services, knowledgeable workforce, so people understand dementia and are able to respond appropriately. So that means, first responders having training in dementia so that if they're called to a behavioral health crisis or something like that, that they can understand whether, if that's somebody with dementia having that crisis, then they know how to respond appropriately. So it's really about having those systems in place to provide that, the appropriate supports and services for people living with dementia and caregivers. Dementia Friendly is a component of that. So it's not a standalone, it's certainly part of being dementia capable. But if you think of dementia capable broadly as being the structures and supports, so that would be from the commission and the state plan, that's all part of being a dementia capable state, but right down to local services and supports. And then dementia friendly initiatives are really helping expand that to the whole community and the whole population. So we want to make sure that everybody understands something about dementia and brain health and risk reduction and things like that. They don't have to be experts by any means, but the more people understand dementia and the more people know about it, the less frightening it can be. And so that can help reduce that stigma that may get in the way of people living with dementia and their caregivers from engaging more fully with their communities. Great. We have someone else who has asked, what specific services are funded for DARS to provide needed services to individuals living with dementia? Yeah, so DARS itself, apart from my role, doesn't have, and the funding for the care coordination at UVA, and I guess the products that we're developing through the commission, the other services that DARS provides are really available to all older Virginians. So those would be the Older Americans Act programs that are delivered through the area agencies on aging largely. While not dementia specific, they are certainly programs that can help support people living with dementia. So a good point of call is to start, if you're looking for services and supports, is to start at your local area agency on aging. So the services and supports available will vary by region, but if you start with your local area agency on aging, they'll be able to direct you to either dementia-specific programs and services or other supports and services that can help. And you can find your local area agency on aging by going to the website in the chat, vaAAA.org. They're sorted by locality. We have someone who's asking, currently, how is data collected regarding the number of persons living with dementia and caregivers? Such a great question. It's, I guess, the main way is
the ways you've seen. So that Medicare and Medicaid data is probably our most comprehensive. Otherwise, you know, the only way we would be able to get a really decent number on the, or a more exact number would be to kind of comb through everybody's electronic health records. Of course, everybody's on different systems, and so we're not able to do that. So we have to look at it. We estimate it. We use the behavioral risk factor surveillance system. We look at other types of data, such as admissions to state hospitals. But yeah, we don't really have a good way of collecting the exact number. And this is something actually we were talking about yesterday in the data work group. What could we do, and could there be a state registry to get a better handle on the number of people living with dementia? But it's not a reportable disease. It's not communicable, and so it's not reportable under the Centers for Disease Control. So there's no legal mechanism for having a registry. A few states have volunteer registries, but they're really not very well taken up, and so they haven't added much to our general picture of dementia. So we're left relying on the Centers for Medicaid and Medicare data and the BRFIS data primarily.
We have someone who has joined us who is part of a care management firm, and I'm sure, like many, is struggling with workforce. And curious if there are any state level incentives that they can offer the labor pool to entice them to our state, whether tax credits, housing assistance, or other ways. We need more labor. Anything that you can give insight on that?
So that is a huge question. Unfortunately, I don't have a good answer for that. It's a little outside my wheelhouse. But again, that's something that you could advocate for through your local state representatives. It's a statewide issue, and it's a nationwide issue. Everybody is struggling with trying to hire adequate numbers of staff, particularly in long-term care and behavioral health. So unfortunately, you know, there is no pat answer. But again, those kinds of supports through the tax code to encourage workforce retention and pulling people into Virginia would need to come through the General Assembly.
I agree with you, George. I think just advocating to your local elected officials is a great way to start that conversation. We have just a very straightforward question. Is Virginia considered a dementia-capable state?
Well, we're working towards it. So we're probably not fully there. Well, we're definitely not fully there, but we have so the Dementia State Plan gives us a really good picture of what that would look like. So if we were able to fully achieve the Dementia State Plan, we would be a dementia-capable state. So we're definitely on the road there, but we're not quite there yet.
Do you know if dementia is part of the curriculum for CNA, LPN, and RN coursework?
So there is a dementia component. I'm not sure of the exact number of hours required, but yes, there is dementia included in certainly in CNA. I'm not so sure about the RN.
We have someone asked a bit of a specific question, but we'll give it a shot. If someone has a pacemaker and can't get an MRI, are there some other ways to determine what type of dementia the person has?
So I am not a healthcare professional. I'm a little reluctant to give that a stab. I would talk to your healthcare provider about that. There are some other diagnostic methods available. Whether they'd be appropriate in that case or not, I'm not sure.
Well, I think with that, and I think that's a great answer, George, I think that At this point, we're bumping right up at 2 o'clock, and I just want to say thank you, George, for you joining us and sharing all the work that you guys are doing. As you mentioned, when it comes time for that survey in January, we'll get that out to everybody who participated. Later today, we'll get this webinar recording posted, as well as your contact information and the links and the toolkits that you mentioned out to all of our registrants who participated today. And I'll just remind everybody that I hope you'll join us next month on the 14th at 1 o'clock for Toxic Ageism, Losing a Decade of Longevity with Dr. Jay White. And again, just for any upcoming information, you can always just visit vgcoa.com. And I thank everybody for being with us today, and we'll see you next month. Thank you, George. I really appreciate your time with us.
Thank you so much, Martina, and to everybody who joined.
Thank you.